Okay, Mr. Malo, so I'm going to go ahead and start your interview today. I'm going to ask you a series of questions. Just go ahead and answer them the best that you can, okay?
Yeah.
At any time, if you need me to repeat myself, just let me know, or if you can't hear me, just let me know, okay?
Sounds good.
All right, question number one. What are the main expectations of a green scrub while working in the hospital?
I think it's mostly just be behind the desk and serve pills and med kits.
Okay, yes, good answer. And then also just learn hospital rules, practice your mic rules, assist with scenes, and work under supervision. Okay,
Okay.
question number two. Why is it important for green scrubs to remain supervised?
'Cause it's the first rank of EMS, so like a lot of people like are gonna be trolling and stuff. So just they gotta make sure that they're doing what they're supposed to do. 'Cause if not, it can make the whole faction look bad. If they're not doing what they're supposed to.
All right, great answer. Okay, question number three. Who should you contact if you need help during a hospital scene?
Help during what?
Oh, sorry. Who should you contact if you need help during a hospital scene?
Um, Well, if it's like PD, then you'd go to like chain of command, so like the next rank up, and then if they can't handle it, then they'll go to their rank up, and then so on and so forth.
Oh, perfect answer. Okay, number four. Why is proper micro usage important during medical RP?
Oh, because if you're not using the proper macros and stuff, that could lead to like a RP13, and if this is like I was saying like PD, that could also lead to a dismissal if you get a RP13 and stuff.
Okay, perfect. Yeah. So yeah, micros helps. The micros keep RP structure professional and clear during medical scenes. A great answer. Okay, where are green scrubs allowed to sell med kits and pills?
Oh, that's behind the desk in the lobby.
All right, perfect. Why is learning hospital structure important at this level?
Because once you get your promotions and stuff, you don't want to be clueless. So it's just gonna help you learn your job better, and it's just gonna make you overall a better coworker for everybody in the hospital.
Amazing. Great job. Great job. Okay, what should you do if you see someone breaking hospital rules?
Well, me personally, like I was a general in PD, so I always go by make sure your body cam's on, and then just take it through the chain of command.
Amazing answer. Great job. Great job. Okay, let's see. What skills have you learned that prepare you for white scrubs?
Well, I think the major thing is communication and understanding and patience are probably the top ones.
All right. Yes. Great answer. Yep. Understanding rules, micro use, and hospital procedures. Okay. When must your body cam be turned on?
Me personally, I always keep mine on because you never know when a situation might arise and you might not have enough time to have it on.
All right. Great answer. Yes. Perfect. And especially during when you're responding to CPR calls. Okay. What happens if a medic uses a firearm while in the medical faction?
Oh yeah, they getting dismissed and probably a ban if someone records it and put that in.
All right, great answer. Yep, and that's our MD Rule 5. What is the maximum pill limit per patient?
That's it.
Great, perfect. When are you allowed to refuse medical treatment?
You're not allowed to.
Correct, but the only time you can refuse medical treatment is if the patient has a weapon in their hand.
Oh yeah, yeah, yeah. Or like if the scene is like unsafe. Well, that's for like CPR, I guess. If the scene
Yeah.
is unsafe.
If it's unsafe, like you're performing CPR and like there's gun violence, shootouts, things of that nature, do not perform the CPR. You'll just go ahead and leave the scene, and that will help protect yourself as well as the patient. All right. Can you demonstrate how to teach a green scrub how to do CPR?
Yeah, so I'll tell them, firstly, I'm going to go to the backpack and I'm gonna make sure they know that they want to use the red emergency kit. And then I'm going to tell them they're going to go up to the body, they're going to look at the body, and then they'll drag that red kit onto the body, and then they'll do the assessing vitals macro, and then they'll do the second macro, which is begins performing CPR.
Perfect. Oh shoot, did my thing glitch? Can you do me a favor? Can you drop the 3 micros for me that you will use during CPR? You probably did, but I think I glitched for a second.
Yeah, I got you. And then after, they'll probably want to med kit, so. But
Perfect.
I don't think that's the one thing I don't see. This is the one thing I did need clarification on. If we giving them CPR, in that instance, are we allowed to still give the med kit, or that one's no?
No. So you'll do the CPR first. Once they pop up, you'll then offer them the med kit. You can always offer them a med kit once the CPR is completed. It's up to them if they want to accept it or decline.
Okay. That was the one part I needed clarification on.
Oh yeah. The patient will either decline the med kit or take it. It's just you just still offer it.
Okay.
All right. Great job on your very first interview with EMS. I do want to go over what you will be responsible for as a white scrub. You will need to complete your first CPR field training with a field training director before riding with blue scrubs or higher. Attempt CPR calls on 3 separate days each week. Finish 35 total CPR attempts. Respond only when a blue scrub or above is present after clearance, and submit CPR logs with body cam footage. You will also complete taser training and safe driving training. In the hospital, you will follow all MD and HP rule, sell med kits and pills only in the hospital, and keep your logs organized. For pharmacy, you will learn the full structure, completing a 30 vitamin appointment, logging correctly, knowing pill limits and policies, understanding regular and VIP appointments, pill dash and PD army drops, having your micros ready, and passing a 15-question pharmacy quiz. Once all requirements are done, you will book your next interview through Setmore. Do you have any questions for me?
Yeah.
All right. So, Mr. Malo, you did amazing today with your interview. You answered every question perfectly. I think you did really well. I think you're going to do really great here at Laguna EMS.
Thank you. I appreciate it.
Of course. So, I'm going to go ahead and salute you right now. Give me a moment. Congratulations, Malo.
Thank you.
So soon, I'm going to go ahead and send you over your your welcome packet through Discord. Okay?
Wait, Savannah.
Oh, sorry. Yes, Dr. Kennedy.
Because it's Tuesday, I can actually rank him up right now.
Oh no, he needs to be ranked up now. Oh my gosh, he did such an amazing job. Yay!
And then you can do this.
Okay, awesome. Okay.
Thank
Yay!
you.
Congratulations, Malo. You did really great. You deserve this position.
Thank you.
Okay, I'm gonna go ahead now and sending you over your welcome list, your welcome packet, as well as your checklist. Okay, and if you have any questions or anything of that sort, just don't, of course, message me.
All right, thank you guys.
Of course, have a good one. You can just go ahead and go back downstairs, complete your tasks, and we do have pharmacy training today. So if you want to complete that as well, you can. Today's Tuesday, right? Yes.
What time is that in Eastern time?
Let me go ahead and recheck the time. Oh my gosh. Okay, so today it's going to be at. Wait, hold on. 7 p.m. Okay, 4. Oh, sorry, that's me. 7 p.m. Eastern Standard Time.
Okay, perfect, perfect. I'm actually on break at work, so
Okay.
I'm gonna be off for a little bit, but I'll be back about 4 p.m. Eastern.
Okay, perfect. Sounds good. Okay, well, congratulations. And again, if you have any questions, don't hesitate to ask.
Okay.
And also, taser training is